It's Valley Focus, and I'm Kayla Mortellaro, your guide for the program as we turn our attention here to Scott Kelley, CEO of SolV Independent Insurance Associates, and Melissa Shaw, HR Manager with Barney Trucking. Scott and Melissa, thank you both very much for your time on the show today. How are you both?
I'm doing great. Thanks for having us, Kayla.
Yeah, looking forward to the conversation. We have a lot to try to dissect and get into. So, Scott, before we get too far into the interview today about healthcare coverage and important information for employees to know, what is your background in health insurance and what does SolV Independent Insurance Associates do for people?
Yeah, thank you very much, Kayla. SolV Independent Insurance Associates, we're a full-service employee benefits brokerage firm specializing in alternative funding strategies that significantly reduce local and national employers' healthcare costs. So we are helping make a difference out there in lowering healthcare costs.
Melissa.
A little bit about.
Oh, sorry. Go ahead, Scott.
Oh, I was just going to say a little bit about my background. I've actually been doing this for 35 years, and I've seen a lot of changes in the healthcare industry over that time.
I can only imagine how many changes you've seen, and we'll certainly get into a few of those and how it pertains to people listening. Melissa, as an HR manager, what do you feel is your responsibility when working with health insurances to best cover your employees, but also taking into account employee feedback of what's important to them?
I think the most important thing for us that we look for in our healthcare, especially on the HR side, is making sure that we have coverage for employees that is going to, number one, meet their needs, that it's going to be accessible where they live and where they work. So we are a company that's really spread out. We have hubs in a lot of rural areas. And so we try to really make sure that the hospitals and the doctors that are in those areas are going to accept that coverage. And not only that, but then that they're not going to charge an exorbitant amount of money for their services.
Scott Kelley, CEO of SolV Independent Insurance Associates, and Melissa Shaw, HR Manager with Barney Trucking, right here on Valley Focus. And so, Scott, how can companies find cost-effective health insurance coverage for their employees while also keeping monthly premiums down for employees?
Yeah, that's a great question. And I think, kind of a challenge that a lot of your listeners are probably facing is, every year at open enrollment time, they get the bad news. Insurance costs are going up, their contributions are going up, and their coverage is getting worse. They're having to pay a higher deductible, they're having to pay a higher copay, and not really feeling very empowered to do anything about it. So what we do is we help to kind of address the brokenness of the healthcare system. So what do I mean by that? There's kind of 5 major players in our broken healthcare system: the big hospitals, big pharma or pharmaceutical companies, big insurance companies, brokerages, and lastly, the politicians. We can't leave out or forget the politicians. So as we kind of break down each of those pieces, they're all kind of benefiting from the brokenness of the system. So what do I mean by that? Hospitals in Arizona are billing at 600% to 700% of Medicare. So that means if I go into a hospital and I have Medicare and I have a surgery and it costs $100,000, if I don't have Medicare, I'm going to be billed $600,000 to $700,000. The large insurance companies are negotiating a discount from that, but that discount, even on the top end, is like 60%, which results in my big insurance company paying 300% of Medicare on average. So again, back to my example of a $100,000 surgery, my big insurance carrier is paying $300,000 for that since I'm not on Medicare. Kind of the next bad player in that system is the pharmaceutical companies. And that's driven a lot by something called formulary rebates. And what is that? What does that mean? What is a formulary rebate? Well, I'll give you an example of that. That's basically a payment to an insurance company to put a prescription drug on their preferred list. So a lot of us, we look at those preferred lists. We go to the doctor and we say, "Doc, make sure you prescribe me a drug off of that preferred list." And we feel like the insurance company is looking out for me, and they're putting drugs on that list that have high medical efficacy that are going to help me get better. and also low net cost. But a lot of times those drugs aren't put on that list for that altruistic reason. They're put on that list because they generate a high rebate dollar for the insurance carrier. So let me give you an example of one of those. There's a drug that's a combination of a very common pain reliever and a very common stomach acid reducer. And a pharmaceutical company has compounded those two medications together. If I go down to Walgreens or CVS, I can buy those drugs for about $24. And if I can buy those drugs for $24, my big insurance company has that drug on their formulary list, and they're paying $2,000 a month for that drug. So you might ask yourself, why would they do that? Why would they put that drug on the formulary list when I can just buy these things over the counter? The reason is that drug generates a $1,600 rebate. Every time one of those people go into the pharmacy and fill that medication, that insurance carrier gets a check for $1,600. The next bad player in the system is the insurance carriers. So the Affordable Care Act, the ACA, more commonly known as Obamacare, probably to a lot of your listeners, had a provision in it called medical loss ratios. And the way that works is for large companies, these insurance carriers can only keep 15 cents of every dollar. That sounds like a good idea. You know, we're going to limit these big bad insurance companies from making too much profit. Kind of the unintended consequence of that provision is the only way for my big insurance carrier to make more money is for my premiums to go up. So they're not really interested in negotiating a better price with the hospital or taking expensive medications off the formulary, because that would cause costs to go down, which would lower their premiums, which would lower their profit. And the reality is those large insurance carriers had made record profits since Obamacare was passed. They've outperformed the S&P 500 by double, triple, or in some cases even quadruple in terms of their stock price. The next bad player in the system is the brokerage community. And at SolV, we're a broker. And a lot of us here at SolV came from large national brokerages. And at the large national brokerages, they make something called a contingency commission or an override. Those overrides are driven by placing business or keeping clients with those large insurance carriers. So the brokers are basically incentivized to keep their employers in a place that may not be providing the lowest healthcare costs for their employees. And then the last kind of broken part of the system is the politicians. I think a lot of your listeners are probably feeling like, we just need socialized medicine. Socialized medicine will solve this problem. The problem is that 40% of the lobbying dollars in the United States come from the healthcare industry. They come from all those groups that I just talked about. So the politicians are benefiting from this broken system as well.
Scott, I just wanted to follow up real quick on something that you were talking about with the provisions in the ACA that were trying to limit the amount of money being made per dollar. But in turn, you were explaining that therefore the, loophole, if you will, is that the insurance companies have just risen with premiums and therefore not interested in any sort of negotiating, which then in turn would bring down premiums. So it's like this vicious cycle. So without the provisions, though, we know how healthcare costs were also kind of running away from people. So what is the solution here?
Yeah, what we're doing is we're, SolV is part of a national group of we call ourselves market disruptors, and a growing group representing about 2 to 3% of the brokers nationally. Several of our associates here at SolV are members of a national group called Healthcare Rosetta. And Healthcare Rosetta is an organization that's basically trying to promote these alternative ideas, alternative funding methodologies. So an example would be, rather than trusting my big insurance carrier to negotiate a discount with the hospitals, reimbursing hospitals based on cost plus. The most common and accepted benchmark for hospital cost is Medicare. The majority of hospitals accept Medicare. Those rates all have to be filed. So it makes a very good benchmark. So many of our clients, including Barney Trucking, have moved to a system where they reimburse hospitals Medicare plus. So the idea is to pay that hospital a fair reimbursement. We don't want to gouge the hospitals. We want to pay them a fair reimbursement, but not an exorbitant reimbursement. On the pharmacy side of things, taking advantage of those opportunities to buy prescription drugs at a lower cost. So helping our clients to move to a more transparent prescription drug arrangement where the true cost of those prescription drugs and those rebates are passed through to our clients and also to their employees, which lowers the cost of those drugs for the employees and also lowers the cost of those drugs for the plan. And when we lower costs for the plan, that lowers costs for the employees. And a lot of our clients, just like Barney Trucking, have taken that savings and passed it on to their employees with lower costs that they pay for their health care.
Scott Kelley, CEO of SolV Independent Insurance Associates, and Melissa Shaw, HR manager with Barney Trucking here on Valley Focus. So, Melissa, listening to all of this about the insurance and being the disruptors, if you will, and the reason that Barney Trucking went in this direction, how many Arizonans do you employ? So, for people listening, maybe with similar sized industries, how many do you employ, and what ended up being the deciding factor for Barney Trucking to go this direction?
So overall, we employ about 500 employees in 5 states. But in Arizona, we have 80 employees between 2 different locations. So they're spread out between Mesa and Stafford and kind of all over in between. And really the deciding factor for us to go this direction was that, like Scott said, with our big insurance company, our costs just were continuing to rise year after year after year. And we'd made changes to our plan, changes to our deductible, funding our HSAs a little bit less, doing some different things to help employees realize some cost savings and be able to understand and navigate the healthcare system a little bit better and ways to save money even with a high deductible. And it just wasn't working the way that we hoped and the way that we wanted it to work. And so when SolV came to us with this new idea and this new plan that they had, and they showed us really the slide that sold me was the slide that showed what hospitals were charging above Medicare. And when we saw, in Arizona that they were charging between 600% and 700% over the Medicare cost, that's really what sold me. Because if we can get that even 100% lower, then not only is the company saving money, but our employees are saving money. And in the HR office, it's very employee focused. And so I feel lucky that I get to focus my attention on the employees a little bit more so than the company savings. Other people get to work on that piece of it. But I get to really look at what the employees are doing and helping them. And so it really, when it came down to it and we put this plan into motion, it's really done my heart good to see that we are actually saving the employees' money and not just the company money. So
overall, would you say that company-wide employee satisfaction is very high with their new insurance plans?
I believe it is, yes. There are a couple of things that, are maybe a little bit more time-consuming for employees, where they have to be more involved in their health care and watch a little bit closer with their EOBs and their bills. But when it all comes together and it does what it does, people are very happy with it.
Scott, a lot of times people are very worried about changing insurances because they like their doctor. They like their primary care physician, or if they have a specialist that they need to make sure that they can continue to have access to that specialist. So what do you say to people who have those kinds of concerns to make sure that what they need and who they like and who they trust versus kind of going in a different direction for some cost-saving measures?
Yeah, you bring up a great point, Kayla. And you might have noticed when I talked about the brokenness of the healthcare system that I didn't talk about doctors, because the doctors are not the problem. We talked about what the hospitals are being paid and the pharmacy problems, but doctors are only receiving from these big insurance carriers about 120% of Medicare. So they're just getting paid a little above Medicare. So one of the things that we're able to accomplish when we kind of free up these funds from the inefficiencies is we're able to accomplish greater access to physicians. So most of our clients have elected to allow their employees to go to any physician. And Barney would be an example of that. One of the things that we run into sometimes with these alternative reimbursement strategies is if the physician is not in the network, because again, most of our clients, and Barney would be in this camp, they do contract with a physician-only network. But sometimes there's physicians that aren't in that network. And so one of the challenges that people run into sometimes is when they try to go to one of those physicians that's not in the network, gaining them that access, because sometimes the person at the front office, the front desk, is not familiar with these alternative approaches, and so we have to get involved, or the vendors have to get involved and educate that provider. But the key is improving access to physicians through creating efficiencies in the rest of the program. So most of our clients, and Barney would be in this camp, have elected to allow their people to go to any physician they want to that's willing to accept payment from the program.
Now, I do want to ask one question. Melissa had mentioned the slide that sold her on seeing how much above Medicare hospitals are charging. So, Scott, to you, how are they getting away with that when, Medicare, at least what my understanding of it is that was supposed to be the price guideline. So any sort of upcharge would be when there isn't some sort of insurance in place. So how kind of is that being allowed?
Yeah, that's a great question, Kayla. The challenge is our current system does not use Medicare as a benchmark. So the current system is a discount off of allowed charges. And most of the hospitals, their contracts, if you read through their contracts, they talk about discounts off of billed charges. They don't talk about using a benchmark like Medicare, unfortunately. My hope is that the industry moves in that direction in the future, because obviously it would benefit all of us. But your listeners are consumers of everything else in their life. They go to the grocery store and they might pay 20 cents less for a can of beans, but when they go in and fill their prescription drug, or they have an elective surgery, or they have to go to the physician, oftentimes, or get an MRI, they don't shop around. So that's, kind of one of the key messages that I want to get across to your listeners is be a healthcare consumer. Approach your healthcare just like you do every other major purchase in your life.
Scott Kelley, CEO of SolV Independent Insurance Associates, as well as Melissa Shaw, HR Manager with Barney Trucking, right here on Valley Focus. Now, Scott, there is something that is a provision in place called the No Surprises Act. So how does this protect consumers from unexpected medical bills?
Yeah, the No Surprises Act was passed to address an issue that many of your listeners have probably faced. And that's, you're trying to follow the rules of your plan. You're going to, that Cigna hospital. You've got your surgeon. They're a Cigna network provider. And in walks the anesthesiologist, and they're not a Cigna provider. You get this surprise bill in the mail for thousands or tens of thousands of dollars. And before the No Surprises Act, you would have to pay that bill or try to negotiate that bill away. Also, you're traveling with your family, and you're out of the area, and, your kid slips and breaks their arm, and you go to the emergency room, and it's not a Cigna hospital that you end up in. You end up with this really large bill, this surprise bill. So the No Surprises Act was passed to address just that situation, and it requires the provider to bill a reasonable reimbursement. And there's a lot of regulations around that and how we define reasonable, but it results in protecting the consumer from those surprise medical bills. So if your listeners have faced those kind of bills, there's a lot of things they can do to help themselves out to make sure they're not overcharged for that surprise medical bill. If your coverage is through your employer, reach out to your HR department. They'll tell you who to call, if it's the insurance carrier, if it's the broker, or if they have a customer service resource that they contract with that can help them navigate that surprise bill and make sure they're not overpaying for it. If they have individual coverage or Medicare or Medicaid, one of those types of programs, they can reach out to the insurance carrier, or they can reach out to Medicare or Medicaid. There's a lot of consumer resources on the web about the No Surprises Act. So just Googling the No Surprises Act, they can find out a lot of information to help them advocate for themselves if they have to, if they don't have one of these resources that I've talked about.
Now, also following up with this, a patient goes to the hospital, and sometimes you're in the hospital for a very specific reason and may not be really capable of finding out everything you need to know before you need it. So when things start to unfold, are you in a position, though, afterward to negotiate your hospital bill, and what are some strategies that people should know about?
Yeah, that's a great question, and probably a lot of your listeners have experienced that. And 60% of Americans are carrying medical debt now, so it's a very large number. And so a lot of your listeners are facing that kind of a situation right now. So there's a really good book that I would highly recommend to your listeners that do want to become more engaged and become better healthcare consumers. And that's called Never Pay the First Bill by Marshall Allen. And he gives a lot of techniques to negotiate that bill. But just some tips. First of all, when you have a hospitalization, ask for an itemized bill. So a lot of times the hospital will not send you an itemized bill, but you can ask for an itemized bill and you're entitled to that. And look that bill over. I heard an expert in the industry say that 100% of hospital bills have errors. I experienced this myself when my daughter was born. The hospital billed us for a circumcision for my daughter. Obviously, when we brought that to their attention, they removed it from the bill. But that's a very common example. So look that bill over, make sure that everything was performed that is on that bill, and ask them to remove anything that doesn't belong there. Ask for a cash price. If I pay you cash right now, can you give me a lower price? A lot of times hospitals have a difficult time collecting on those outstanding balances. So if you're telling them you're going to pay them, they're going to be willing to work with you. And they'll probably offer you sometimes a very significant discount just for writing them a check versus paying them over time. But if your listeners want to pick up that book and read it, there's a lot of additional tips on how to negotiate down the hospital bill. But the whole premise of the book is never pay that first bill.
Scott Kelley, CEO of SolV Independent Insurance Associates, and Melissa Shaw, HR Manager with Barney Trucking here on Valley Focus. And so, Melissa, as an employee, what questions do you welcome from your employees about making sure health care coverage is right for themselves and their families? And, how much input do you put into this process as you're moving forward, figuring out every year what health insurance is best?
So I am actually very involved in that process. I want any and all questions that our employees can bring to us. I'm happy to answer those. If I don't know the answer, I have a really great team in SolV behind us. They have helped us so much to navigate this new health insurance platform and setup over the last year. But I want to answer any questions. I'm happy to help our employees figure out what doctors they can go to, who's going to be the best for their family, what's going to work out the best. And as far as input in the insurance renewal process, so I always try to bring up any issues that we've had over the past year and say, okay, how can we fix these things? Is there something better that's going to be better utilized, or a better way to do things? In our open enrollment meetings, like like Scott was saying, sometimes you can ask for the cash price and it will lower your cost significantly. One example of that we've had with our employees is MRIs. A lot of people have to get an MRI for various reasons. And one of our employees went to the hospital and they quoted him $2,800 for an MRI. And when they asked for the cash price, it was only $800. And so that employee was actually able to turn around and turn that into, they paid the $800. They were able to turn around and turn that into the insurance company. And then that $800 was credited to their deductible, rather than being billed later for the $2,800 that they would have had to pay also because their deductible was higher than that. So I'm happy to help with anything that I can for our employees, giving them those tips and tricks, helping them out with phone calls and setting up doctors. It's been great. So.
And Scott, for you, how can employers find out more information with the services that SolV Independent Insurance Associates offers and how best to serve their employees?
Yeah, go check out our website, solvins.com. That's S like Sam, OLV like Victor, INS like Sam.com. solvins.com.
And Scott, are you guys just working with employers, or are you also working with people that find themselves on the marketplace?
Yeah, that's a great question. We specialize in the employer marketplace. So we work with companies as small as 2 employees and as large as, several thousand employees.
And so one final time on the best website for people to learn more.
solvins.com. That's S like Sam, OLV like Victor, INS like Sam.com. solvins.com.
Scott, Melissa, thank you both very much for your time and nuanced conversation. We could almost do another segment of this here next week and still touch on many things that we didn't get to. So I appreciate the time and conversation today.
Thank you so much, Kayla.
Thank you, Kayla.
Once again, that is Scott Kelley, CEO of SolV Independent Insurance Associates, and Melissa Shaw, HR Manager with Barney Trucking, as you've been listening right here to Valley Focus.